Today, I'm going to talk directly to those of you who deal with the struggle of porn and sex addiction. In my private practice, I run lots and lots of groups for very specific areas of needs. However, in my individual client caseload, I work with very specific types of clients. So, a good majority of individuals I work with are men who struggle with patterns of lying, addiction to drugs and alcohol, addiction to sex and pornography. And today I'm going to actually highlight this and talk about the patterns behind it and what leads to it. If you're here and you're watching this, it probably means you already sense that your life might be feeling a little messy, complicated, noisy. You might feel rattled inside, probably have high cortisol levels because your life feels out of control. And that's because this comes from a compulsive place in the brain. So there is neurobiology involved in this. Behavioral interventions are most effective for this. So if you're looking for answers and there's you're hoping for some direction, I'm hoping some of this information I'm going to go over today is going to give you a little bit of a direction of where to start. Um, Porn and sex addiction they're very misunderstood. So most of the male clients that I work with think it's just an impulse issue, and it's a lot deeper than that. It has to do with what are the underlying needs and what are individuals seeking. So generally, men do not receive as much physical touch as females do. Generally, females are more comfortable with vulnerability. We greet each other when we see each other with big hugs. And historically, that hasn't always been encouraged for men. Society is shifting. However, for a lot of the male clients that I work with, what they are often yearning for is a sense of intimacy. And that's a word in itself that is misunderstood. In my men's group, I go over that much more in depth. But the idea of porn and sex addiction, it's actually stemming from a place of wanting safe, meaningful, close connections. And it's usually coming from a place of stress and loneliness and feeling inadequate. So these behaviors start as a way of escaping or self soothing, but eventually they become much more. They become a pattern of compulsion where they become almost impossible to control. And it feels like you're getting in the way of yourself. So, sex and porn addiction can wreak havoc on romantic partnerships and marriages, in your work and your ability to concentrate and focus, complete tasks, your sleeping patterns, your appetite, your ability to follow through with obligations. Really, it's much bigger than what we want to acknowledge and what we want to admit. And the behaviors start from seemingly innocent testing the waters, but it soon escalates very quickly. The truth is, the triggers for addiction, it often comes from everyday things. It can come from boredom or stress. Sorry, my puppy's yawning in the background. Or it can come from a place of feeling isolated and unwanted if you're in a relationship. But rather than turn inwards, we often find ourselves turning to vices. So the first step to changing the pattern is understanding that you're not weak or you're not broken. It's that you're acknowledging that there's a need you haven't been able to meet yet. There are ways to confront these patterns. There's very specific clinical interventions for them. And it starts with helping you lay out what is going on in your life, what's going on in your romantic relationships, what's going on in your personal life, at work, so that you can begin to develop insight into why this pattern exists. I'm going to link my information below. There's also articles on the website that helps you just kind of gauge where you are. Sex and porn addiction is something that it does change your wiring. So I would encourage you to reach out, whether it's to a group, whether it's for individual therapy, but you want to work with a licensed professional who really can help you develop insight and help you start to create change so that you can stop these patterns. Please take good care in the meantime. And I look forward to speaking with you soon.